for which actually the trainee has to put a lot of effort to do audits, research products. They have to do data collection and analysis. They have to write up papers, case reports, to attend and present in conferences. All these things will need to be done over and above the normal working hours of a training. So without hard work, I don't think the trainee would be able to achieve this. And probably I can say that in some other countries, you may have a dedicated timing for do some of these projects. But in India, I don't think we have dedicated time for this. Most of the trainees are overstretched in their own work, but on top of this, they have to do this. That means definitely the trainee needs a lot of hard work. So how what is hard work? To achieve success in life, you need to put a lot of effort. Without hard work and determination, there is no success. And there is no shortcut to success. Failure happens when you are not trying enough. Hard work, I think Ilango will come up with an idea of smart work because he is going to talk about intelligence. So I want to highlight few things about smart work also. Hard work involves commitment, involvement, and sincerity. Hard work is a honest work. And working smart requires planning, proactive, and should not be reactive. And again, I would like to stress, smart work is not a substitute for hard work. Actually, when you have a goal in mind and work hard, then only the work will be smart. Without hard work, you cannot work smart. Both should go hand in hand. So hard working is the most important key to success. The achievements without hard work is impossible. And a person who is working hard is able to gain the success and happiness in life. And an idle person can never gain anything if they sit and wait for the better opportunity to come. And again, slide on work smart. If you look at the slide on work smart, hard work is the key component in it. If you take the hard work, the working smart will not, be there. The working smart adds few other things like innovation and SWOT. SWOT is like you have self-assessment. You should know what is your strength, weakness, what are the opportunities, what are the threats you have. You need to assess those things. But even after assessing, if you don't have a hard work, you will not be able to achieve the goal that you want to. Sorry. And this is a busy slide which actually says what are the things that you need to have as a trainee. You need to have a communication skills. You need to continuously improve your skills, whether it is a clinical skills, clinical knowledge, or surgical skills. You need to continuously improve. And you need to improve human relations by interpersonal skills. You should have good knowledge, good skills, good attitude, and you should be having a problem-solving mind. You should be able to have decision-making mind, and you should have organizational skills. All these needs a bit of intelligence, but without hard work, only intelligence will not be able to carry out that work. And working smart doesn't mean be lazy, cunning, or you have a shortcut. Working smart is applying hard work in a special way. It is not how hard we work, but we need to work with this, strategy and plan and hard work. If they all go together, then only you'll be able to, get the success. And again, setting smart objectives and leveraging on your own SWOT, that against your strength, weakness, and your opportunities and threats, and achieving, effective results. So I would like to conclude with these few slides. I think I've given brief, view on why hard work is important rather than intelligence. Hard work always pays off. Hard work never fails. Without pain, there is no gain. And I can tell there is no replacement for hard work for success. As a surgical trainee, I can tell, from even my journey, I've worked in so many places. I can say, first of all, I would like to ask, even the surgical training work itself is a hard work. It is not like a normal work. Like you go 8 o'clock and coming back by 5 o'clock. You need to always stretch your work. Either you have to come early. Some hospitals operate very early at 5 o'clock in the States, or sometimes there is a case, you need to wait and finish the case rather than, coming out of it. That is the responsibility the surgeon should have. If you are not ready enough to work hard, it is very difficult to be a successful surgeon. I think that's my, finishing touch for this talk. I'll hear from Ilango. I think he will show more, and then I will have some points from him. I'll rebut, after his talk.
Sir, GDS sir, you have comments, or shall I start my slide share? Mahesh, you have to discontinue your slide sharing.
1 second. Stop share. Okay, fine. I did it.
Are you able to see my screen? Thanks once again to GDS sir and Patta Krishna sir. We wanted to start an LGS debate. The topic came to me when I was just about to sleep a week ago, and we were reading about numerous Facebook posts about surgical trainees who are getting depressed, stressed out during the beginning of the year for a surgical trainee. So we thought we will initiate a discussion based on this debate. And the question which we raised was, what is needed for a good surgical student? So I deliberately left the question open-ended, like who is a good surgical student? It's not just an MS General Surgery student or an MCH postgraduate. I think all of us remain good surgical students for our entire lives to be a good surgeon. And we picked up two things, whether to work intelligently or to work very hard. Now, this I would like to dedicate to Dr. Professor Chandramohan. Professor Chandramohan was a great debater, and he was very, very fond of arranging debates in multiple topics in GI surgery. His witty perspectives and his force of arguments have been the lifeblood of many conferences. He will be missed sorely in all our academic programs, especially among his students. To the master. So for the younger colleagues, I want to state that this is a debate for our young colleagues to understand perspective. These skills, intellect or intelligence and hard work are complementary. We want you to listen to the debate and understand how to view each problem from all the angles. So intelligence or intellect is the faculty of reasoning and understanding objectively, especially with regard to abstract matters. So it's something that is not very, very clear. And hard work is one which entails a great deal of effort or endurance. This is probably the technical definition of this, but we still do not know what exactly hard work means in surgery. Like, should we spend more time? Should we actually sweat in the ward, meaning that you work without AC? Or should we put more effort? That is something which I want Dr. Mahesh to clear. And my debating points for the day are 4. So the key thing is perspective. Perspective is the key to good surgical training. And that perspective does not happen in your hard work. It happens in your mind. And what I wanted to tell, like how he was pointing out, you work very smart, not just very hard. And the key thing is what your mind knows during your training at that particular point in time. What your mind knows is very, very important. And the last one I want to highlight is that imagination, which happens in your mind, it's because of your intelligence, has no limit. Now, there is a lot of discussion on cognitive training in surgery. So I would like to highlight this too. Now, intelligence, I'm defining as the ability to learn from experience, the acquisition, retention, and the use of knowledge. It's a very, very important component of intelligence, not necessarily the only one. Intelligence also means the ability to recognize problems by putting the knowledge you have gained to use. You have to identify problems in the surrounding environment which needs to be addressed. And you must learn how to solve those problems. So these 3 components constitute intelligence. I think from simplifying this, it's quite clear that the ability to learn from experience, to recognize problems and solve them at the bedside for the patient is the key ability of a surgeon. So that's my first point I want to highlight to the youngsters, GDS sir. Intelligence is very, very vital for the surgical trainee. Now, Thurston, who did a lot of psychological work on the different mental abilities, listed actually 7 different mental abilities that constitute intellect or intelligence. They are associative memory, that is the ability to memorize and recall; numerical ability, the ability to solve arithmetic problems; perceptual ability or speed, the ability to see differences and similarities among objects; reasoning is the ability to find rules in an abstract system; spatial visualization is the ability to visualize relationships between the components of the environment; and verbal comprehension, the ability to define and understand words; and word fluency, the ability to produce words rapidly. So these are the 7 different mental abilities. For the surgeon, I feel probably the 3 key ones are perceptual ability, the ability to see differences and similarities between tissues. The numerical values are very, very key. The ability to find rules in a new environment and circumstances is also a very key aspect of training. The third one is spatial visualization, the ability to, it's like a 3D thinking, the ability to visualize relationships between each components of the therapy and the diagnosis or the evaluation. They are all key components of learning and becoming a good surgical student. So, and last of which I have not highlighted, it's associative memory. It's probably also the ability to memorize and recall them at the bedside. It's also a key ability for a surgical student, and I think they cannot be skipped. Good surgeons have to develop these skills as they go on. So that is the intellectual part of your surgical training. Now, Howard Gardner is another psychologist who worked on intelligence. He talked about the multiple intelligence concept. And what is surprising is that Howard Gardner's perspective fits the surgical student in all aspects. The bodily or the kinesthetic intelligence is the ability to control your body movements and handle objects skillfully. I was listening to Dr. Cherian's interaction with Dr. Bishwarupal, and I found that even in the 70s, his ability to handle the long rider instrument, palming the instrument, is a kinesthetic intelligence that goes a long way in building your surgical skills. Interpersonal intelligence, the ability to detect and respond appropriately to moods, motivations, and desires of others in the environment. Especially, it's very, very important for a surgeon, because surgeons are not guys who work alone. You have to work as a team. You have an anesthetist, you have a colleague who is another qualified surgeon. You probably will have 2 or 3 colleagues working with you. You have theater nurses, scrub nurses, managers, secretaries. A lot of interpersonal work happens in surgery. So interpersonal intelligence is very, very important. Intrapersonal intelligence, the ability to be, the capacity to understand your own self, called self-awareness, and being in tune with your inner feelings, your values, your beliefs, and your thinking process is very, very key to a success as a surgeon. The last one is visuospatial intelligence, is the ability to think in images and pictures and to visualize accurately and abstractly, is one of the most important things a surgeon needs in life, not just as a student, but throughout his surgical career. So the surgics, I mean, looking at this, even when you characterize intelligence, if you look at all these things, I think a surgical student requires every one of these things for success in his life. So my personal thing is that, yeah, intelligence on these lines are very, very important in building up a surgical career for a young surgical student. So this is something which I always talk about. Intellect is the one which changes your perspective. Whatever hard work you do, the amount of time you put in, the amount of effort you put in, can work only from this perspective. Intelligence can actually change your perspective completely. So now, this picture is from the Dead Poets Society. He says, I climbed on the desk to remind myself that we must always look at things from different angles, and the world always looks different from here. So I was a general surgical student in Trivandrum. My perspective about certain surgeries were different from the perspective I learned as an MCA GI surgeon, and from there I went on to become a independent consultant and then a transplant surgeon. And the perspective each time was changed because of the new knowledge and the intelligence that you gain and from the experience of seeing things from a different perspective. We all know the story of the old crow. If you update, you don't have to put in a lot of effort. You just need a straw. So you have to find the right solution to your problems. You don't have to necessarily follow the old stuff, but I think a lot of things have developed recently, and the ability to intelligently think on your feet is probably the key requirement for the modern surgical student, just like the crow given in the picture. A lot of surgeons have heard this: what the mind does not know, the eye does not see, the hands does not feel. So it starts like this: what the mind does not know. So intelligence is probably the first step in actually getting to become a good surgeon. It's not the reverse. Now, just working on a few things more. Intelligence in a surgical student's life, these are the things that are important. I've highlighted 5 of them. Knowledge, quantitative reasoning, by which I mean that you have to know your numbers, the number of drops you're going to set in, the amount of fluid you're going to set in, and stuff like that. Visuospatial processing, the ability to look at imagery and then understand what those images mean. So that is a key one. Your working memory, and the last one is fluid reasoning. I mean, fluid reasoning is the capacity to think logically and solve problems in new situations, independent of the acquired knowledge. That is actually thinking on your feet. It's thinking outside the box. That's a very, very key thing, component of general intelligence, probably more important for the surgeon. Now in order to, I don't want any of the younger ones to get overwhelmed. This is how I broke down surgical intelligence at work. So the big chunks of data, you can make it bite-sized pieces. Some of the things which I've taught is about using numbers for remembering reperfusion data, using numbers for remembering which patient to take for with colorectal liver metastasis along the pathway and stuff like that. So you have to break them to bite-sized pieces. The bite-sized pieces probably for the senior surgeon may be larger, and for the younger surgeon may be smaller, but it's good to break all your big chunks into bite-sized pieces which you can remember. Use checklists for tasks with multiple steps, especially like your WHO surgical checklist and things which you're likely to forget. The third key is to develop routines. If you do certain things in a certain way, I'm not saying it looks intelligent. I think it stays in your long-term memory, and then is the ability to recall those steps is quite easy. I think one of the things I developed as a surgical PG was how to read a CT scan for high cholangiocarcinoma. We call that the EVHM protocol. E stands for extent, V stands for vascular involvement, H stands for hepatic lobe atrophy, and M stands for metastasis. So whenever we were questioned by Professor Ratnasamy, it was very easy to just go through the protocol in our heads and just look at the data and actually present. He is very particular in getting all the information. So we looked at these things. So you develop routines even to read CT scans and practice working memory skills. And these memory skills comes with repetition, but the repetition has to be spaced. And some of them recommend a power nap for reboot, especially when you're tired. So sleep well for good memory skills. And you should also experiment with various ways of remembering information, and obviously reduce multitasking, which means put away your cell phone and use mindfulness to minimize distractions, and certainly add exercise to your daily routine. A lot of people say that the largest number of chunks you can have in your working memory is about 7. For me, it is about 5. So Naturally, because my intelligence was less than the others, I took up to a lot of hard work in keeping up with the Joneses. Now, the other thing I feel a surgeon has to develop for being a good surgical student from the point of intellect is to develop one-pagers in surgery. One-pagers in surgery will help you think along timelines in a very, very in a small space. You can go along the entire timeline. A lot of my time is spent making those one-pagers, which I really enjoy. Most of my house is filled with papers of my ideas about different situations. And it allows you to have cross-pollination of ideas and your ability to see things across the departments. I learned from urologists much earlier because I was assisting most of the PCNLs. I learned from pediatric surgeons, so I was more convenient in operating in small spaces and learning different perspectives. So intellect is the ability to use every experience that life throws at you and then making it work for you. No amount of hard work will help you that. I think you have to change your perspective with each thing. This is another concept about intelligence, which I'm very, very fond of. It's called thought bandwidth. Some of the surgeons which you have seen, you know, are always quiet, relaxed, not bothered about the magnitude of the complication. And they just walk into the theater, just scrub in and solve the problem altogether. And I've always wondered how they do that. Anyway, this has been something which I was very much interested in. And I was fortunate to work with some of the top surgeons in the world, and the opportunity to watch some of the top surgeons. So I've always wondered, and I came up with this thought. I call this the thought bandwidth. The thought bandwidth, as long as your bandwidth is really large, there is no mental fatigue. For a young surgeon, when you have a bleeder, your whole mind becomes full of that bleeding. And if that repeats a couple of times, you get into a mental fatigue. You can handle probably one or maybe two problems in a surgical theater, but beyond that, probably it leads to mental fatigue and errors, and people probably will, the surgery may become undone at any time. That is probably one of the reasons why we tell about youngsters to have a surgical mentor by your side, especially to pull you out of those circumstances. If you develop good thought bandwidth by reading, experiencing, working out your mind on the different perspectives, and then training yourself for those skills, your thought bandwidth actually will widen to the extent that you will use less than about 5 to 10% of your thoughts to actually execute a process. So that's one thing. So if your thought bandwidth is low, I said you will have a very poor response to crisis. And again, if your thought bandwidth is low, you will have a negative outlook towards difficult circumstances, and you will never look forward to those things. And you will have missed diagnostic and treatment opportunities, and certainly you will miss opportunities for research. So intelligence is very, very important for the surgeon because you have to enlarge your thought bandwidth, whether it is as simple as hernia or as big as a live donor liver transplantation with multiple issues or some things like that. Your thought bandwidth should encompass as much as you can. This wide experience and thought bandwidth is probably very, very important. By become who you are, by learning who you are is a very, very important, Raj. And learning actually feeds your mind, Recently, I mean, the COVID circumstances, it is very difficult to actually look at things. So this is an interesting article I came across. You can look it up. It's from orthopedics, and it's from the Journal of Pedagogy, I think. And it's cognitive training for prevention of skill decay in temporally non-performing orthopedic surgeons. So it's a medical specialty. Ours is a medical specialty with complex psychomotor and cognitive tasks, and they will lead to skill decay when the tasks are not being performed for a certain period. But this was originally made up in 1998. But what I have seen is that I learned from one of my teachers, Hema Vishweshwaran, who was a pediatric surgery professor at SAT Hospital in Trivandrum. she taught me this, if the ability to keep your skill from decaying is completely dependent on your mind. It's not dependent on your just your fingers or your handwork. So skill decay can be adequately prevented if your cognitive training is very good. So novice surgeons in surgical training, so you are actually vulnerable to early decay of the skills, which can happen after a short retention interval. But if you have gone through and your thought process is quite established, you can go without operating on a particular disease or a condition. And then when you start operating, it will automatically come back to your mind. So that is how your training should be. That is your training goal. So intelligence is very, very key. Probably the only place of hard work is the repetition number in surgery. That's a process repetition and a procedure repetition, which actually defines the case volume, which we all, and quite a few of the journals talk about case volume for expertise. And this is the only place of hard work. The other reason, the benefit of a large case volume is that you see all the scales of presentation and the course of illness. And obviously you have more opportunity for research and training in those circumstances. Apart from that, hard work is a complementary skill for the sake of the debate, Mahesh. And the last one is a quote from Albert Einstein. Logic will get you from A to Z, but I think imagination will get you everywhere. One of the key skills I learned from Madurai Medical College from my seniors is to imagine and live a different world. I mean, as a child, it's very easy to live in an imaginary world, but it's very hard to live that in a real situation. But some of my teachers and my senior postgraduates used to tell me that, no, you get into a circumstance, if you want to get out the first time, you should have done this in your mind. So imagine is a very, very key factor in intellectual learning and intelligence in surgery. It's the ability to form new ideas. It gives you the ability to bring images. It gives you a perception when the imagery is born out of memory than in a real world circumstance. The last few slides of the philosophy with which I learned this. This is a very wonderful book which anybody can read. It's by Robert Pirsig, who wrote this book in the midst of a lot of difficulty. It's a classic. It's Zen and the Art of Motorcycle Maintenance, an inquiry into values. And one of the key questions which you asked at the beginning of the book is, what is good, Phaedrus, and what is not good? Need we ask anyone to tell us these things, stating that it is all known in your heart? So another key quotation is, the place to improve the world is first inside one's own heart and head and hands, and then work outside from there. So you see the perspective, whatever you want to do first happens in your heart and then in your head, and then works down to your hands, and from there it works outwards from there. So that is what I wanted to talk about this in this debate. So a few things for the sake of the youngsters and for the surgical teachers. There is a very beautiful circumstance given in the beginning of the book. I've just given this so that people can read about this. It's available free on the internet. And it talks about the hero or the author of the book stating about seeing a red-winged blackbird during his ride on the motorcycle, and he whacks Chris's, his son's knee, and points to it. And he says it's a blackbird, and the son is at 11 years of age. He's not very impressed. So he says at age 11, you don't get very impressed with red-winged blackbirds. Some of our young surgical trainees are like that, and we tell them about things. It looks very funny, they are more interested in seeing the big and major surgeries. It's very difficult for them to understand or get them impressed with small surgeries like hernia surgeries, which actually makes a lot of difference in the community. So what happens is that at the end of the book, he again says, Chris stands behind on the bike over his shoulders and always keeps saying, oh, ah, and wow. And then he asks and the author asks, what's the matter? And he says, it's so different. He says, what is different? Everything. I could never see over your shoulders before. And then the last one, he says, that's true. I never realized it. All this time he has been staring into my back. Now, as teachers, I always feel we block perspective of the younger surgeons, and that is extremely detrimental. I'm very, very careful not to block the perspective as I become senior. This is very, very common in our profession. The more senior you become, you actually block the perspective of a younger surgeon who might do better to stand on your shoulders and see the further distance. So for the younger surgeon, you should realize if you have been staring into the back, try to get a different perspective. That can happen only from intelligence. So as I look into the debating points, perspective is key. Perspective happens in your mind. You work smart because not just hard. I used to work for 110 hours during my transplant training every week. But then I learned how to work smart. Then my work became a lot easier and I had more thought bandwidth to actually pick up skills and understand perspective during the training period itself. So everything begins with your mind. What your mind knows, your hands will do and your eyes will see. And the last one the best part of intelligence is imagination, which has no limits. And it is now taken as cognition, which is very, very important for surgical training. And in Raymond Kirk, when he visited Madurai Medical College in 1993, gave us all during the lecture, he gave us, use your eyes, use your hands, use your loaf. So I leave with this parting comments and the debate is open. Over to you, GDS sir. Thank you.
Well, nice points from both sides. I would like Dr. Maheshwaran to add on few points which he would like to on this issue.
Sure, sir. Thank you very much for this opportunity. I think from the presentation from Ilango, I can see a lot of hard work that he has done. Without hard work, he would not have presented this very nice.
That is a punch on the face.
Okay. So I should thank Ilango for putting a lot of hard work in bringing up, the presentation very lively, interactive, and a lot of things he has given. So I've got few points, and Ilango has very nicely put everything as an intelligent, like surgical intelligence, interpersonal intelligence, intrapersonal intelligence. All these things we used to say interpersonal skills, intrapersonal skills. The skills actually you need to learn by the hard way, not like just by imagination. I think imagination is the key for some of the profession where you need to imagine a lot to do things. But for surgery, I think especially in surgical field, in the overall through the medical field, surgical field, I think we are a little bit gifted in getting a disease which has got a set kind of symptoms, signs, the image findings to make the diagnosis a bit easier. Where if you keep seeing more number of cases, I don't think you need a lot of intelligence to make a diagnosis. With your experience alone, with your hard work that you have put during your, medical training period, that alone is enough to make a diagnosis. I completely agree. Intelligence is an important part, in everybody's life, not only in the medicine or surgery. In everyone's life, intelligence is a very important point. But the question here is what the good surgical student needs. Obviously, there is, there are some slides that were missing. Actually, there were slides which says, what is the requirement of intelligence and hard work as a trainee, as a consultant, as a, academician or a monk. So what it says is, as a student, you need to have 90% hard work, 10% intelligence. When you become a consultant, you need to put 50-50, where you need to delegate work to others. When you become an academician, where you spend a lot of time on academic activities, you need to have more intelligence, kind of, 75% intelligence and 20% hard work. That is the kind of scenario. But for the purpose of our debate, where a lot of surgical trainees are listening to this, I think they need to put a lot of hard work rather than intelligence. They need to do a lot of hard work in learning the skills. And another funny thing that I just thought is funny is like Ilango was saying that we are using a lot of mnemonics to remember all those, the structures or the steps and all those things. I can tell you mnemonics. We say Sister Lucy's powdery face often attracts medical students. Actually, these mnemonics we used for the branches of the external carotid artery. Where there is an intelligence, you just imagine something else for your anatomical structure. There is no intelligence. You just remember things. And another things like Ilango was mentioning about, you make it everything routine, and you have a checklist. If you have a checklist, you don't need intelligence. You have the checklist. You tick box everything. So you work hard to tick the boxes. So you go and look at the checklist saying that, yes, I've done this, I've done this, I've done this. That actually requires hard work rather than intelligence. And he also mentions actually different age group surgeries that he mentioned, that he has done pediatric surgery, he's done transplant surgery, he's done like a routine hernia surgery. I think, as you know, Ilango is my very good friend. I know how he worked really hard to come to this stage rather than intelligence. So he worked, I think I actually admire him for his hard work. He says to me, see, I always stay in the ward until 8 o'clock, 9 o'clock. I don't think that is an intelligence, that is an hard work. So that's the reason why, he's...
Mahesh, that was because I was not intelligent, Mahesh.
but I can tell you, because of your hard work, you have come up in life so much. I think that is the key to the success. Rather than just intelligence alone will not put you through the ladder to come up in life. Another thing is like prevention of skill decay. There is a publication that you have mentioned that I want to just give you. I think intelligence alone will not prevent the skill decay. You said some cognitive skills and all this, and I've seen, and so many people have told me that if I don't do this surgery for some time, I may not be able to do the surgery with perfection. That is because we lose the skill. To have the skill as a good surgeon, you need to keep doing things, or at least seeing things, or you need to have the mind to go on, look at the steps again and again. I think that needs hard work rather than intelligence. I think that's my rebuttal on, for the surgical trainees. I think there are a lot of people are seeing this. Ilango has persuaded you to just to have an intelligence, not to have a hard work. I think hard work cannot be replaced in surgical training. And without hard work, it's very difficult to achieve all the skills that we need to acquire during the surgical training period. And actually, life is a learning. The learning is a lifelong process. Even if you learn as a surgical trainee over a period of 3 years, you still have to learn. I've seen a lot of in my institute, a lot of people who have been trained completely, but still they feel like they haven't seen something, they want to learn more. That kind of work, what they do is over and above the normal working time. I feel they are all putting a lot of hard work to learn more, to come up in life and to be a successful surgeon. I think I don't deny that intelligence is very important, because you need to understand a lot of things for which you need an intelligence, but intelligence alone will not give you a success. And a routine surgeon who's like, for example, everybody who is doing a general surgical training, at the end of their career, they have to do their, bread and butter work like hernia surgery, appendix, a gallbladder or something like that. They have to get that skill by hard work. Then only they will be able to do those things independently. Then only they'll become like a good surgeon. On top of that, rather than doing like a private practice, if you want to be more excellent, like an academician, or like you want to do like a super specialty after super specialty, I think you need to put a lot of hard work each and every step of the way. Without hard work, it's very difficult to come up in ladder. I think I made it a bit more clearer that, I should thank Ilango, but he has given a lot of information about hard work, but he just, put that perspective as an intelligence.
Dr. Lingo,
I think hard work is important than intelligence.
He made me right about.
Yeah. Dr. Lingo, would you like to say something now?
Yeah.
Before I try to conclude the meeting.
Sir, I'll take a couple of minutes, sir.
Yes.
So, Mahesh, like I was saying before, What exactly is this hard work is very difficult to define for the surgical training. Does it mean if you put a first year student for 12 hours duty and he stays for 16 hours, you mean he's a hardworking person? Does it mean, like I said, he works in a very hard environment with no AC and things like that? Is that very good? He works with no food. Is that hard work?
No.
What kind of effort do you define? All those things, I am not clear. Okay. And you told me about interpersonal skills. I wrote as interpersonal intelligence, but have you ever tried interpersonal hard work? That is difficult to achieve, isn't it? Paari? And checklist, nice thing, nice take. Mahesh, what I will say, yeah, checklist was created by an intelligent surgeon. What I wanted the youngsters is to create their own checklists. I think that requires intelligence. The same goes for mnemonics. Like somebody was intelligent to create that. Creativity requires intelligence. I think skill decay, I didn't want to discuss. So Mahesh was very particular about repetitive muscle memory. Yes, it is a very, very important thing. All of us know the value of muscle memory that comes with the good repetition of skills. But what I wanted to state again is that hard work focuses on the present. Something is established and you want to execute it. Hard work keeps doing that and stays there. Unless you have intelligence which has a future perspective, somebody thinking differently, surgery will not progress. That is my last point. Thank you. GDS, sir.
I think both sides have put up very valid points. Both are dependent upon each other. The mere intelligence without hard work can cure no patient, can improve no surgeon. Mere hard work without intelligence can also help no patient. But when I look from today's debate is from perspective of a surgical resident. So I would put hard work much more important than intelligence. Let me repeat, we have two prevalent training systems on the globe. The British system, which says you have not yet known all the anomalies of cystic duct or artery, or you don't know all the anomalies of gallbladder development. How can I let you do gallbladder? Or you have not passed your master's, how can I let you operate? And an American system, which says you haven't done 100 gallbladders, how can I let you appear? So, given an opportunity, if we have a hardworking boy who is punctual, who cares for his patients, comes prepared for his cases for 4 years or 3 years, by the end of that time, he will become a very good surgeon anyway, because he has 100 repetitions of every case. My philosophy would be, this is the time to perfectly learn how to do a good ileostomy, how to look after its complications. If he doesn't know some metabolic changes of ileostomy at a mental level, he has whole life to learn. But during his residency, it is his hard work, because everywhere the surgery is also earned. In India, we say you earn your surgery. In US, if you don't do those earned formalities, one is out of the program, right? So hard work on bedside, repeated examination of the same patient, and repeated examination of the same disease with different spectrums involves physical effort with mental backup. Interpersonal relationship. One intelligent guy made a mnemonic, but all average can remember and succeed. When we are talking today, we are talking of a vast population of residents which we have. I agree with Dr. Lingo that if each generation of residents were not smarter than their teachers, surgery would have never progressed. the common saying is, a daughter magnet is poorer than the parent magnet. But some daughter magnets, maybe 2%, maybe 5%, maybe 3%, are brighter than their teachers. They were more intelligent. They were consistent on their work, that they led to certain innovations, progress in science, research, better methodologies were created. So when we look at an average guy, if he does his patient care well, he will earn his more surgery. And if somebody is taught properly that dexterity and the basic tissue handlings and the muscle training, whether he does not operate for 1 month, 2 months, or 3 months, it should be his autonomic reflex. Once grinded, then it is like an art of which I cannot name here on the social platform. That somebody is devoid of a particular physiological function for 6 months, given opportunity performs very well. And the surgery should be like that. So once trained, is trained forever, right? So putting all the things together from both sides have done exceptionally brilliant, and both are exceptionally brilliant surgeons, much better than me. Because of my age, I'm sitting here. So, but I would say, to summarize the whole thing, 65 to 70% is the hard work, and 30% should be the intelligence. Number 2, during residency, hard work is more important. Intelligence can come later. Once you have left your teaching department, when you left your mentor, then there will be nobody to tell. I will, at this particular conjuncture, I would like to share my survey on a very, very basic issue of tying and suturing properly. Let me very honestly say, 90% of residents which I meet cannot tie a proper square knot as today. Where is the fault? They are not taught the basic issues properly. One of the senior faculty, when I was visiting as an observer, when I saw him also tying grainy knots, I asked him, does it matter? He laughed over and said, Dr. Sharma, it does not make any difference. Right? So it is those 3-4 years of hard work consistently, and fortunately, if one has a good mentor to take care of and make the boy ride on his shoulder and grow beyond his level. Such kind of mentorship is vanishing in the country, and it is the responsibility of our generation. All bright people of the country are, and even surrounding countries are on LGS today. And if we try to own our residents and work hard with them, you see, our job today is to, what I commonly say is, I cannot teach anybody surgery in 3 years or 4 years, but I can teach the art of learning surgery. The learning is for whole life. So, but the basic hard work, dexterity, patient care, procedures need to be taught. That is where we are different from a physician. Few things are technical. They are best taught during this period. That comes with hard work. So concluding remark would be, both are essential skills, 65 to 70% hard work, and the rest intelligence. Thank you. I would like some good comments from, we have many brilliant people on the audience today. So I would love to have some short and crisp comments. Sir. Yes.
Ilango and Mahesh, I think very nice debate. You guys, both of you had put up very valid points and excellent concluding remarks and perspective from Dr. Sharma, given his seniority and experience. But I would humbly like to differ a little bit with Dr. Sharma.
So, you know, we can be the best friend and differ pole apart. All right, welcome.
So yeah, one thing is it's given that the hard work it's given that hard work is a must. You have to have hard work throughout the 3 years. But the way you work hard, I have my own perspective is that the way you work hard should be different from when you are a first year versus the way you work when you are a final year chief resident. First year is when you work, I think it's 90% manual, 10% is intelligent work. But I feel as you progress in your residency, the way the manual work, the proportion of the manual physical work should be, replaced by more and more of intelligent work. So the chief resident should also be working 12 hours or 14 hours or 16 hours a day as a first year, but not necessarily as a first year resident itself. So by the time a guy evolves into a surgeon, it comes out of MCH or finally MS, he has to be different from a first year. So I think as time goes by, he has to apply more intelligence. And then, there are several other skills that make a good surgeon. Like he has to be intelligent to find a good colleague where he can confide with his mistakes and also learn from the other guy's mistakes. He should be intelligent enough to find a good mentor and intelligent enough to be humble so that there are not many enemies for him, and he should be intelligent enough to form a good team, intelligent enough to form a network. I think all these things are also important as just physical work. And most important thing is, by the end of the third year of final year residency, one should have intelligent enough, you should be intelligent enough to pick up from non-verbal clues from seniors and faculties. These are things which are going to make a lot of difference as you enter into the real world of corporate practice or being a consultant. So I fully agree that hard work is essential, but the way somebody works should be different from when he is a first year vis-a-vis when he is a final year or chief resident. So I think intelligence is also important, and proportion of the manual work may be replaced by higher time for smarter work and more knowledge-based work. So I think both of them are not mutually exclusive, but this is the perspective that I have for a person who's evolving from a first year to a consultant.
Thank you. Thank you. Dr. Patta, can you have a couple of comments organized?
Sir, Patta sir, I think he's in another meeting.
Okay, all right. Anybody else? Welcome. We can have 2 more comments.
Can I give a comment? I'm Dr. Ravi Shankar.
Yeah, sure. We met before. Yes.
I'm a graduate of Maulana Azad Medical College, and having seen the intensive training the surgical residents used to get, that got me interested in the same specialty. I did my MCH after that. So I'll just tell you a little bit about the training of MCH. I was fortunate to have a very good teacher, and how they mentor us is something really remarkable. The first day he just said, go to the operation theater, and I was just waiting, and he came and shouted, why didn't you start the case? Next day I did this anatomy, and then he said, why aren't you going on bypass? So that is how we got indoctrinated into the specialty. He would tell me that 2 years was the course in MCH, no leave granted, but every 6 months he would give me 10 days leave and ask me to go to another center. He would give me a letter addressed to the professor, like Professor Venugopal in All India Institute, and spend 10 days there and learn from the other masters. After doing my MCH also, I thought it's very good for all of us, whenever we get time to visit other centers, whether they are senior or junior to us, it's always good to keep learning, see how the other people work. So I think the residents should also be given an opportunity to visit many other centers during their training, which gives them a wider perspective. That's my take.
That's nice. That is the magnanimity of the chief. That's what I'm trying to say. The chief should be willing to promote his trainees beyond him. Yes, sir.
Sir, can I?
Yeah, sure. Waiting for you.
Hello?
Yes, sir. Please.
Yeah, can I start?
Yes.
Okay. So there's some audibility. So being an anesthetist, I'll be possibly talking a bit generally for the lot of youngsters in the group, in the whole LGS. Firstly, I'll try to explain intelligence and talent. To me, they are not synonymous. And because talent is what Mahesh posted in one slide, SWOT analysis, strength. A good mentor helps in identifying the talent or strength of the person, and the intelligence of the person makes sure that the talent doesn't go waste by putting in adequate hard work. That is the relation between intelligence and talent. And I think hard work alone is a very general term. Smartness in application of hard work creates high quality effort output ratio, other which eventually, so that is what we say now. We always see some trainees, some are fast learners, some slow learners. Because how smartly someone is putting in the hard work. And in this process of learning, smart work, what I understand is experience is a process of creation. Just because I have participated in a surgery or an event does not allow me to have the experience. It only makes me go through the event. It is when I'm not what about it, that is what is creating experience. And regarding Ilango's point about skill decay in COVID era, I will go back to Professor Ugadia's time, the conversation, where he said that that was not his first lab poly. He had done 100 lab polys in his mind before that first one. So what we do within our mind is a much bigger, hard work than physical hard work. And lastly, why I will agree with GDS sir regarding 65-35, that quantifiable expression, is because visibly or measurably there is nothing called talentometer or intelligence meter, but hard work is always visible and perceptible. And that's why we always love hardworking guys. Intelligence is less perceived and sometimes not liked also. So intelligence or talent does not entitle a person to skip hard work, because those other qualities will go waste. Thank you.
Thank you very much, all the participants. I will be grateful to Dr. Maheshwaran and Dr. Lingam for their contribution, and all our friends. Because of paucity of time on a Saturday evening, it's obligatory for me to close the discussion. Thank you very much, and very lively discussion. We'd like to have more debates like this. Thank you very much, Dr. Maheshwaran and Dr. Lingam. Okay.
Thank you everyone.
Thank you. Thank you very much.
Have a nice Sunday tomorrow. Okay.
Bye, sir.
Bye.
Thank you, sir. Thank you. Nice discussion, Ilango sir.
Thank you, sir.
Thank you.